today's demonstration, I will going to perform obtaining of complete vital signs. The first thing we will do is the assessment. The client's clinical signs of fever, clinical signs of cardiovascular alterations, skin and mucous membrane color, position assumed for breathing, signs of cerebral anorexia, chest movement, activity tolerance, sign and symptoms of hypertension or hypotension, chest pain, and factors that may alter core body temperature, pulse rate, respiratory, and blood pressure. Determine the policies and procedures for the facility. Next is planning. Assemble all the equipment and supplies for the implementation. Prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do and why it is necessary, and how he or she can participate. Wash hands and observe other appropriate infection control procedures. Provide for client privacy. Place the client in the appropriate position. For the temperature, clean the thermometer. Place the thermometer for appropriate route or site. Wait the appropriate amount of wipe the thermometer with a tissue if necessary. Read the temperature. For the pulse rate, select pulse point. Assist a client to a comfortable resting position. Palpate and count the pulse. Place 2 or 3 middle fingertips lightly and squarely over the pulse point. Assess the pulse rhythm and volume. For the respiration, observe and palpate and count the respiratory rate. Count the respiratory rate for 60 seconds. And inhalation and exhalation count as one respiration. Observe the depth, rhythm, and character of respiration. Wrap the plated cuff evenly around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. If this is the client's initial examination, perform a preliminary palpatory determination of systolic pressure. Position the stethoscope appropriately. Auscultate the client's blood pressure. And for the evaluation and documentation, document all the obtained vital signs in the vital records sheet.